friends home safely.
Do the right thing.
Visit ArriveAlive.org to find out more. Arrive Alive. Drive sober.
This is Rogers TV. This program is brought to you by Rogers Xfinity, connecting you to more of what you love. Visit Rogers.com for more details.
Hello and welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today I'm delighted to welcome two guests to the program. Brenda Scott and Norah Beatty are here to talk about the Ontario Health Coalition and protecting the public healthcare system. So I want to welcome you both to the program. I'm really interested in what you have to say and additional current information you might be able to share with us. So welcome to both.
Thank you.
Thank you for having us.
So first of all, can you help me understand a bit more what the Ontario Health Coalition actually is?
It's a health advocacy group that covers the province and advocates basically for the public healthcare system. We have a number of different divisions throughout the province. So Norah and I, for example, are co-chairs of the Grey Bruce Health Coalition, which is a division of the Ontario Health Coalition.
So
The coalition, sorry, if I could just add, the coalition was formed about 45 years ago in Ontario. Ever since really the Canada Health Act was introduced in 1984. And they have been fighting since that time to maintain public health care. And there have been attacks and attempts to privatize our public health care since that act came into place.
Which still keeps us busy.
it certainly does. And I'm going to want to know a little bit more about you in a minute about what even got you interested in the coalition. But for those who may not be exactly sure of what public means and what private means, I'm assuming when you say public, you mean like hospitals and home care. But maybe
the whole range.
Interesting because public health care, people generalize and think that all hospitals are public health care, but in fact, they are, but there are also private health care hospitals. And so public means that the services that are medically necessary under the Canada Health Act must be covered by public funding, so government funding, our taxes. But private health care is, people make the mistake and think that it is totally paid by individuals who use that clinic or healthcare facility. Which is not totally the case. The government actually does subsidize to varying degrees private healthcare facilities. And one of the things that confuses people is they think, oh, well, if it's private and people who are rich enough can afford to pay for it, that will help us. Why should we object to that private healthcare facility? When in fact, our tax dollars are paying for a significant amount of, for instance, the 30-year contracts with private long-term care homes, or for the public, this current government has gone to changing what we call private health care. Instead of calling them hospitals, they're calling them clinics. But in fact, they're doing day surgeries, which they're very much like
the lines are getting very blurred between the two. Yes.
Care. Sorry,
Yeah.
I didn't hear you, Brenda.
Pardon?
I didn't hear what you said. I was still
Well, I said the lines are certainly getting very blurred between the two.
Yeah.
And so what we're doing, a lot of what we're doing is talking to people about public health care and about some of the concerns that we have about the move to privatization of services. We've seen a lot of that in the last several years, increasing, it seems, every year. Yeah. In some cases, the services that Norah has referenced that are paid for through tax dollars. Sometimes those hospitals are paid at a higher rate than your public hospital down the road for the same procedure.
Wow.
So there's a lot of unfairness built into the system.
And sometimes those private surgeries, as well as receiving an individual's payment, they are also receiving, as Brenda mentioned, a similar payment for the same process that they were given. So the private for-profit health facilities have to make a profit. That's their number one reason for being. So if they were just to receive the same amount as the public facilities received, where is the profit going to come from?
So they also bill, for example, insurance companies? Is that what you're meaning about how they bring additional revenue in, or how do they're subsidized by tax dollars partly?
The
Yes,
surgeons
they
in
are.
a,
And in addition, they'll often charge the patient.
Okay, so I would have to pay additionally out of pocket then.
you
Yes,
would,
I'll
and
give you an
sometimes you're asked
example.
to pay for additional services that are medically necessary and you shouldn't be paying for. But because
Oh.
people don't understand that OHIP covers medically necessary care, they end up paying because the clinic asks them to, when in fact that service should be covered by OHIP.
So I have a lot.
A perfect example would be cataract surgeries. We hear a lot about cataract surgeries because a lot of people get referred to a clinic, and if their understanding is that it's going to be paid for by OHIP, and then sometimes after the procedure, they're handed a bill for a few $1,000s, which kind of belies the government's statement about, you'll pay with your OHIP card, not your credit card. There's a lot of credit cards involved in these procedures anymore.
And more you hear of cataract surgeries as just a lot of people need that surgery. So that opens a lot of questions. So before I get into those questions, tell me about yourselves. Tell me what got you interested. It's obvious that you're really keen about this and getting the message out, but I'd like to know a little bit about you. Who wants to go first?
I'll go first. I was the last 6 years that I was working before I retired. I was working for CUPE doing communications, sort of as a secondment from my regular employment. And I was asked if I would join this new committee about healthcare. And that's how I went to my first OHC meeting, and I met Natalie Mira there. And fast forward several years later, I did actually retire and decided to spend my retirement years as a healthcare activist.
And I'm actually a retired high school vice principal and former teacher. And so my background is not in healthcare, but a few years ago, I became increasingly aware of things that the government was doing. And I was acutely aware, really, that our public health care was at risk. And so it was at the time when they were doing the referendum, and I discovered there was no Grey Bruce Health Coalition. So I hooked up with the Simcoe Health Coalition and started to distribute leaflets for them. And shortly thereafter, Natalie Mara got in touch with Brenda and I and asked us if we would be willing to work together and form a Grey Bruce Health Coalition, which we did. And that was about 2 years ago now, 2 years almost this month.
Yeah, it is actually. We're coming up to an anniversary.
Yeah. So I really have been advocating for vulnerable people, whether they were the children, special education kids that I worked with for most of my career. And now I've been advocating for the maintenance and equitable access of public health care. I believe very strongly in that. And in fact, my grandfather was one of the people who campaigned on the prairies with Tommy Douglas way back. So it's an important issue.
Excellent.
And my parents too campaigned for the Canada Health Act. And so we share sort of a family upbringing where this was a very important issue.
Describe to me, you've used the word awareness, that people need to become more aware, because I'm thinking that this is a gradual erosion that you've been describing. People are not understanding that some things we may assume are equitable and equal and paid for are not. Brenda used the cataract surgery as a prime example. So certainly we need to increase the awareness for people to understand. Now, right now we're in some challenging times around the relationships between Canada and the United States and tariffs, but we've also paid with people need to go to the States to have surgeries, correct? That some of our OHIP funding has helped if people require that. What do you think will happen, or do we? I mean, I know we don't have a crystal ball, but people don't always think of healthcare as a service or product, but it actually can be, especially if people wish to have treatment that either have long waiting lists or they want to go elsewhere for it. Any
We're
idea?
very, sorry, we're very worried actually about what the future holds for public health care, because the focus, and rightly so, right now is on tariffs and the issues around annexation and whatever Trump is going to be doing, which nobody knows from day to day or hour to hour. But while that focus is there, I personally have a concern about what is happening behind the scenes with the Ford government in Ontario, because we know from our experience over the last 7 years that he's been in as Premier of Ontario, that much happens behind the scenes and we don't really hear about it until there's some public announcement and legislation is passed. So we know that he is committed absolutely to privatization of our healthcare. I wonder what kind of deals he will make or is making south of the border as part of the services component of these tariffs. So it is a huge concern, actually. And I think our current role from the coalition's point of view, one of them is to maintain the focus on public health care and the issue, because, bringing it down to the level of Grey Bruce, people don't have doctors. They have to travel further and further for hospital services, the cancer care services, for instance, in Owen Sound that were cut back just before Christmas. So it's affecting people. Many, about 44,000 people in Grey Bruce alone don't have a family doctor. So we have to keep educating the public, and that's a huge part of our current role.
Yeah.
And Grey Bruce is one of the, when I talked about the various local coalitions, who, by the way, are meeting this afternoon. But Grey Bruce is one of the larger areas. Of course, we can't discount the largest for sure is Northern Ontario, Thunder Bay and up there. But we're certainly one of the very, very large ones too. So we cover the peninsula right down to just south of Kincardine and way over to
Down in Blue Mountains.
Blue Mountains, exactly. So
Okay.
it's a large area. There's a lot of rural communities, and so rural issues are another focus that we've had to deal with. We've talked to rural communities throughout the province. I also chair a committee called the Small Rural and Local Hospital Committee for the province, and for OHC. And so last year we did a tour of several of the rural communities, and all over the province. The story was so similar in every location, that people would, in every place, we heard the phrase, rural Ontario is under attack. People feel that somehow they're being specifically targeted with these privatization programs, with whatever's going on. And we heard stories, heartbreaking stories throughout the province. And, we're putting that together in a big report that we are going to put out later this spring.
Yeah.
But the issue kept coming up, why are we so disadvantaged? And yet, I know we're just 2 weeks out from the most recent election, but the rural Ontario basically voted for the same government. I think probably the driving force may have been the Trump issue. As Norah says, from hour to hour, we really don't know what he's going to have to say. And we've given the Ford government, again, a majority that just doesn't seem to work for everybody in the province.
There is a glimmer of hope there, though, I think, in that, yes, they are still a majority, but he didn't get the improved mandate that he wanted. And in fact, he currently has 3 less seats than he had in 2022 election. And if we look at the statistics in Grey Bruce, Owen Sound riding, in 2022, Rick Byers received 48.56% of the votes in Grey Bruce, Owen Sound. In 2025, the PC candidate, Mr. Vickers, received 44.1% of the eligible voters or the votes that were cast in Grey Bruce. So we have made a slight change in the electoral outcome, but it's not nearly enough. Again, we'll be addressing in the upcoming federal election some of these same issues, although healthcare is primarily a provincial responsibility. There are overlaps, and there is a role for the federal government to play for sure.
So I wanted to ask a little bit more about health outcomes, and back to the rural issue, because it is important to understand that rural health care can be different or harder to access. And I'm wondering if you can talk about what you've learned since you've been involved with the coalition and before about rural health, because I'm not sure that people from the more urban centers capture all the differences related to rural health. If you could cover that, and then also talk about what the coalition would like to see as achievements around rural health and access to health care.
I'd like to start, if you don't mind, because until I retired, I was living in Toronto.
Okay.
So my career was in Toronto. I was an urban person, and I've lived in Grey County since 2011, full time. So I've lived in both systems, if you want to say. And I can personally tell you, I've used both systems. I've been in hospital in Toronto. I've been in hospital in Owen Sound. And I would say that the biggest difference I see is there is an unequal lack of equity, lack of access to healthcare. And one of the founding principles of the Canada Health Act is equitable access, regardless of how much money you have, regardless of where you live, whether it's urban or rural. And I think for certain, that loss of equity of access is very real. Many people, I mentioned the 44,000 in Grey Bruce who don't have a family doctor. Many people who move to this area, and a big factor in deciding to move here for retirees or anybody is, will I have a family doctor? Many are unaware of the fact that they won't, and are on wait lists for 6, 7, 8 years in some cases.
Yeah, some of the people that were lined up in Walkerton there
Yes.
in February were saying they had been on a wait list for more than 7 years.
The other thing I've noticed is people in rural Ontario, I've said before that they need a Bill of Rights for rural areas, because many of them are so used to a lack of specialists that they're used to waiting 6 months, a year, 2 years. I waited a full year a year ago to see a respirologist. A full year. And I'm told now I need to see a dermatologist, and I could be waiting a year or 2. So I keep hearing stories from people, and yet people here seem to think, well, that's the way it is. Well, that's not the way it should be, and that's not the way it is in the city in most cases. So I think there needs to be a change in expectations, and as I said earlier, more education about what should be. And the change to the cancer care services at Owen Sound that were announced just before Christmas, I find very troubling. They're having trouble attracting an oncologist to replace one that has left. And as a result, newly identified cancer patients in particular areas are no longer able to be served healthcare in Owen Sound. So they have to travel to either Barrie, Kitchener, or Waterloo, I think it is. So distance traveling, and you know the kind of winter we have, it presents barriers to healthcare in rural Ontario.
And particularly for rural seniors, I think, too,
Yeah.
because when we're talking about distances sometimes that are just insurmountable.
Yeah.
I talked to a woman up near Halliburton who has to drive 3.5 hours to see her family physician because she hasn't been able to get a family physician in her own area. She's 82 years old, and she says she a lot of things she just lets slide because she doesn't want to have to book that long appointment. Hers is a kind of an extreme example, but we hear it all the time, that the distances are a factor. In rural areas, you often don't have a public transportation system like you would have in the city. You could hop on the bus and go see your doctor. Well, you can't do that in a rural area as easily. And so the tie-in between healthcare services and other public services is also something that needs to be addressed, because it makes it more practical if we're looking at it as a whole system.
Yes, and that's a really good point. I'm really interested, Nora, in your comment that rural Ontario needs a Bill of Rights around healthcare because, and you're 100% right, both of you have nailed it. It is a system issue. The system is broken, and often systems interconnect. Transportation systems, healthcare systems, they both rely on each other. And the other is we have gotten used to having less. So we take it as normal. Your comment about you wouldn't have had to do that in a city is quite, it turns the light bulb on. We're so used to.
There's another issue too that comes to my mind, and looking at areas like Muskoka and Grey Bruce, the issue of board governance for local hospitals. Right now, Muskoka is their birthing unit in Bracebridge is being shut down, and everybody has to go to Huntsville for birthing. Here we've had the Durham Hospital, which has had all of its inpatient beds removed quite summarily and quite quickly without community consultation. In Chesley, we have I think this is our 4th year of part-time ER services. And so there are many, many examples. I talked to women up, I'm thinking around Hearst. They have to drive 4 hours to get to a birthing unit. And I'm sure all three of us can think about what that would mean. I mean, one of my children would have been born on the side of the road. So, there's so many commonalities, and Norah is absolutely right. A Bill of Rights for rural patients would be so helpful. And I think that I'm hoping that will be part of what we'll be focusing on next.
Now, you both have been involved in this for a while, so I have 2 parts. What surprises? What did you not know about that you really wanted to learn about, or you didn't know? And what positive things from your involvement have you had happen? So what were the surprises, and what were some positive things that either you've experienced or you feel moving forward that you will be able to take with you?
The positive things during the election campaign, obviously, you might guess that we were a little unhappy with the result. But during the campaign, our membership increased substantially. We've met a lot of interested and committed people throughout our area. We have a lot of hope going forward, working with them as well. So it's the people, I think, that we've met that would come to my mind first when you ask that question.
Yeah.
Yeah.
How about you,
Yes,
Norah?
I think the awareness has grown. I mean, when we did the referendum in 2022, or 23, was it? I'm losing track.
23, I think.
23, it was 23, yeah. We had 10,000 people vote no to privatization in Grey Bruce. And that was after, I think we had formed the Grey Bruce Coalition 2 months prior to that. So we have raised awareness and engaged people, but there's still a long road ahead. And one of the things that continues to surprise me and dismay me, actually, are some of the comments that I do get from people about our healthcare system. And for instance, the most recent comment I had from somebody was referred to the long-term care home situation and the the payment of $400 charged to elderly who refuse to go to a home a long ways from where they are living because of this new Bill 7 that insists alternative care patients must be removed from hospitals to make room for acute bed patients. And the comment really was a very ageist comment and took, it was like they were very hostile towards these elderly people, and not actually all of the people who go to long-term care are elderly. It could be somebody who's severely disabled who needs long-term care and nursing care of some sort. But the comment told me that they basically had this ageist perspective that was writing off seniors. Like, let's get them out of the hospital. How dare they take up space that's needed by an acute care person? And the judge, in fact, who ruled in the case, which the Ontario Health Coalition unfortunately lost, was ruled against recently. The judge said that $400 a day charged to these elderly patients and their families was not out of line, which to me says they have that's a well-to-do judge talking, who has no concept of what a pensioner might be living on or an elderly patient might have access to in terms of paying for health care. So that
A lot of what we
comments
do.
like that continue to surprise me, and that tells me where we need to focus some of our future efforts.
Yeah.
I was just going to say, a lot of the awareness raising that we want to do is around things like Bill 7, which is, in my opinion, one of the most egregious pieces of legislation I've ever read. And ageism is certainly a factor in it. There's a lot of time is spent following the legislation that comes in. Sometimes things are included in omnibus bills.
Yes.
Some little thing that makes a huge negative change for some group is tucked into a great big bill and barely gets noticed at the time, and later on people suffer the consequences. But Bill 7, Nora's absolutely right. It's an ageist document that never should have passed.
And on that note, I can't believe our time is up. It has been absolutely wonderful speaking to both of you. I'm sure you will be busy in the days and months ahead, but I want to thank you both very much for being on the program. And I want to thank our viewing audience for joining us today. We've been having a conversation with Brenda Scott and Norah Beatty about the Ontario Health Coalition and protecting the public health care system. Thank you both, and take care. Stay well.
Thank you. And you.
Connect with us by visiting our website or email us at comments@rogerstv.com.
public transit, garbage pickup, parks and recreation programs, snow removal on your street. How can you stay informed about these and other important local services? Tune to City Council coverage on Rogers TV. See your community leaders at work on Rogers TV City Council coverage.
After a night out with your friends, not having a plan for a safe ride home can leave you in a bad spot. You could end up riding in a police car, an ambulance,